All right, welcome back to Smith's Saturdays, everyone. So, the topic this week is I had a good discussion with one of my friends of mine who I run triathlons with, and she gave me an article that she read on hamstring stretching and why it shouldn't be as commonly stretched as it should be, as it is, and she asked me like why that was. So what I wanted to do this week is kind of talk a little bit about muscles around the hip, the hamstring, the IT band, that get blamed a lot for a lot of, especially running and physical activity pain, that aren't necessarily the culprit. So what happens is, just because you happen to have a sore hamstring on the back of the leg doesn't necessarily mean it needs to be stretched. So a common misconception is that a sore muscle, all you need to do is hold it in a long stretch position for 30, 60, 90 seconds to kind of let the fibers elongate. Well, what happens is that just because you have pain in the back of your leg, say when you run, doesn't mean that your hamstring is actually the problem. The hamstring attaches on the ischial tuberosity, which is the base of the pelvis, kind of underneath your bum cheek. So when you stand, if you stand with a very flat back, or you stand with a very curved back, that's going to rotate the hips and the pelvis. So the way the hamstring attachment is positioned is going to change. So you might go for a run and have a really sore hamstring, but are you running because you actually have a stiff low back that doesn't allow the hips to rotate? Do you have a sore hamstring because you have a little bit of sciatic irritation and you feel tension in the back of your leg? Do you have a sore hamstring because your knee actually isn't moving properly, therefore the distal, the further part of the hamstring is actually tight? So stretching muscle just because it's sore isn't necessarily the answer, and I know a lot of people whose muscles actually get overstretched because they're continually moving muscle. It's not actually the problem. So get assessed by a good therapist to tell you what the actual source of your problems are. Is it muscle? Is it a knot? Or is it actually decreased muscle length, which needs to be stretched? The same thing, for example, the IT band on the outside of the knee. Just because someone gets a sore lateral compartment on the hip or the knee, the IT band is another structure that gets blamed, but it's just a band of dense connective tissue. So again, is it the fact that your knee isn't moving properly? Do you sit all day and therefore your glutes get really weak and the other muscles and fibers have to kick in to stabilize structures? There's a lot more going on than people think, and as therapists, some patients who are a little more challenging to treat are people who are active, who have gone online or read cliche common misconception material. So a lot of part of our job is debunking common myths. So what I'm going to do over the next few weeks is take some really common issues that people talk about and try to debunk them based on what you actually see in clinic. So, as always guys, cheers and thanks for watching this bit of a longer video. Okay, great.